It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. On today's show, we're going to start by learning when it's necessary to have a hip revision with orthopedic surgeon Dr. Henry Small.
Hip revisions happen for several reasons. One was they just came loose, and they can come loose just because they were never put in correctly, or sometimes they just come loose. And the second reason is infection. About 2.5% of the hips put in nationwide get infected, and once they're infected, they have to come out and you have to start over. Occasionally, I see, like this patient we did recently had been infected for several years. I'd already revised her other hip that was infected, but she's in bad health and she was in a nursing home for many years and had not walked until we revised the first hip. She had not walked in 2 years, and then after revising the first one, she actually got out of bed and was able to ambulate her in the house and for short distances. But the second hip, which had been chronically infected, eventually put her back in the bed and was bedridden. And so we just replaced hers recently. And in this case, her femur was broken in several places. The infection was really bad. I mean, just a very complex 7-hour surgery. But it looks good. 20 years ago, the mortality rate from a hip fracture was around 40% of the people died within the first year. And currently that number is around 10 to 15%. And the difference is fixing it, replacing it more often than trying to fix it, replace it with a new hip and get out of bed and get back, just get back to activity as soon as we can. I think that hip replacements, for the most part, have just been one of the few miracles of modern science. I mean, you take somebody who's either has arthritis or a broken hip that literally cannot function in life, the pain is so severe, and then do a typical normal hip replacement is an hour surgery. And you can have a hip that's absolutely normal. In fact, 95% of the hips get so good that people forget they had one. And it becomes a normal hip, and they can go on with their life and do everything in the life that they want to do, with extremely few restrictions once they're healed up. I really love what I do, but what I love most is trying to take somebody whose life is really just totally destroyed because of what's wrong with them, because of pain or disability, and trying to get their life back. And that encompasses such a much more than just the surgery. And that's what I enjoy. It's getting someone's life back.
If you want to have decent hearing when you're in your 90s, you can exercise your ears. Simply turn on some music and practice singling out a single instrument and listening to it. This exercise can help to hear more details in everyday sounds.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda's a patient that presented to my office complaining of shooting pain, down her heel, upper leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
I told him my symptoms. He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done.
This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight, and the clamp on the nerve are the protective covering, which we call the flexor reticulum. The nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful.
What he's trying to do is avoid that numbness, and for most people it works. You know, you basically take what's pinching the nerve off away, and you make room for it, and life goes on.
And the advantage of this is, like, it's not a surgery where you're really held up for a while, where you have to, you know, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own.
I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you know, you're reattaching muscles and putting in screws, you know, really crazy stuff. They also think he's awesome.
The side effect that one has from nerve decompression is not pain. It's lack of sensation. It's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market. To request an appointment with any of the amazing doctors that you see on our show today, just head to our website. It's BestDocsNetwork.com. Go to the doctor's profile page and click on the Request an Appointment tab. You can even request an appointment with our next doctor, who's going to tell us about a new skin tightening procedure. It's cosmetic surgeon, Dr. George Davis.
Well, the issue, of course, is age and gravity. And so I wanted to do the Ultherapy because of it's a really nice lift without any incisions or downtime.
Skin tightening is basically taking a device and taking energy such as heat or radiofrequency energy or ultrasound and tightening the skin to a degree where you can actually see effects. The technology these days will actually harness the energy into a delivery system which is not as painful and gives us better results with less downtime.
I knew that the Ultherapy was immediate results. I knew that the downtime was 0. And I also knew that it would be a pretty general facelift, and that's what I wanted.
The Ultherapy procedure takes about an hour. There is no downtime. It's non-invasive, so you can have the procedure done and go back to work. There is no bruising associated with it since it is non-invasive. The effects of the Ultherapy last about 2 years. And with any type of procedure that you do for tightening, once you have the procedure done, your skin starts aging again.
Have it done. It makes you feel better. It makes your outlook a lot better because you look better, you feel better. And people notice. They don't know what you've done, but they notice that you look great. You look like you have a glow about you. What have you done?
Skin tightening industry these days is really about delivering the best type of energy to get the best type of results. So that's what I like to focus on here at Woodlands Wellness, is that we have researched to find the best procedures for the best results. When we do a procedure, you know that's FDA approved, and it's also going to do the best that we can do to get that result.
You don't have to tell anybody, but other people notice. And it has to do with the brightness in your eyes and just how you feel about yourself, and you want to get up and conquer the world.
To find a doctor on BestDocsNetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you. A tomato is a superstar in the fruit and veggie categories. Tomatoes contain lycopene, a powerful cancer fighter, and they're rich in vitamin C. The good news is that cooked tomatoes are also nutritious, so use them in pasta, soups, casseroles, and salads.
ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face, and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
For more information and to check out hundreds of videos on all of the amazing doctors you've seen on our show today, just head to our website. It's bestdocsnetwork.com. Now up next, we're going to hear about how Joey was able to overcome his breathing problems with help from head and neck surgeon, Dr. C.T. Nguyen.
Gosh, I was young, maybe about 6 years old, and was tagging along with my older brother playing golf, and I just so happened to get too close to him when he was teeing off and got hit with a backswing right in the nose. And from then on, that's when the problem started.
Joey came and see me because he can't breathe through his nose. So he has to breathe through his mouth. He doesn't sleep well at night. He snores a lot, and that makes him tired all the time.
You would sleep through the night but wake up and not feel rested. Even though you made it through a whole night and got a whole night of sleep, you just wake up and feel like, gosh, I really don't even feel like I slept at all.
When we examined Joey, we noticed that the wall in the middle of his nose, what we call the septum, that separate the left and the right side, was crooked, in his case, was crooked on the right side, causing him problem to breathe through his nose. And we agreed upon a treatment plan that consists of first a surgery to correct his septum, to straighten up his septum, so to improve the nasal airway.
Very simple outpatient. Everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you just don't realize it, because I've had it for so many years. You just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, I'm able to do things without getting winded, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a Center of Excellence in Nose and Sinus Disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Carotid disease is a very important risk factor for stroke, and carotid disease develops because of plaque formation in the carotid arteries, especially near the carotid bulbs and involving the internal carotid arteries. Those are the arteries that feed the brain. So people who smoke, who have high blood pressure, have diabetes, these are all risk factors for carotid disease, and many times these go silent. So we try to evaluate our patients with carotid ultrasound, which evaluates the blood flow and the anatomy of the carotid arteries. If we find significant carotid disease, we either think of surgery or carotid stenting. Carotid stenting is an innovative way of treating a patient without cutting on them, which is very important. And many patients are good candidates for carotid stenting. Carotid stenting is done in usually university settings, especially here at the Texas Heart Institute. We have great interventional cardiologists who do this. Ask your doctor about carotid stenting if you have carotid disease. It's a great alternative to surgery.
The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com. University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing.
I'm studying music education and I'm studying opera. I have voice lessons twice a week. I have choir rehearsals every day. I have opera rehearsals all the time. And so I have to be in tip-top shape. And before this surgery, if I sang for more than 30 minutes, I was done.
So some people wonder what GERD is. What's going on is the esophagus tube goes from the back of the tongue down to the stomach. And at the bottom of the esophagus where it connects the stomach, there's a one-way valve that should let food and juice into your stomach but not let it back up into the esophagus. When it goes back up into the esophagus, it can burn the esophagus and then cause the symptoms like heartburn and coughing, asthma, a lot of symptoms.
Acid reflux all day, every day. I mean, I would eat, acid reflux. I would not eat, acid reflux. Have a drink of water, acid. And so it was one of those things. I would wake up in the morning with a sore throat. It would affect my singing, like I said.
So I've been doing surgery laparoscopically for 22 years for reflux and have excellent results. And what we do is an outpatient procedure. Through very small incisions, we go in there and we reduce the hiatal hernia. So that's basically where there's a little gap in the diaphragm and the stomach's protruding up into the chest. So we pull that down and close that gap in the diaphragm and rebuild that one-way valve. The operation takes less than an hour. People usually go home an hour after surgery. They're usually doing everything within a week. And they're usually getting out of the house in 1 to 2 days after surgery.
Actually, I told Dr. Thomas the results of this have been amazing. The very, very first morning after my surgery, I woke up and I almost started crying, literally, because it was the first time in my entire life that I had woken up without a sore throat.
One of the more common things people tell me after surgery is this is one of the best things they've ever done in their entire life. So this heartburn symptoms kind of is in the background of their daily life, and it may not seem like the worst part of any one day, but when it goes away, their quality of life improves so much and they don't have to live with it. They're kind of ecstatic.
It's been an amazing, amazing improvement in my entire life, and it's something that I'm so, so grateful to have had done.
On our website, bestdocsnetwork.com, we have a map that can help you find the best doctor that's closest to you, which could be our next doctor. It's interventional cardiologist, Dr. Annie Varughese.
Miss Richardson, wonderful woman, very busy, and she was just dizzy, and she wanted to be checked out. And we did our routine screenings of our patients where we check the heart with ultrasound, the carotids, ultrasound, aorta, legs, all of those things. But what we found was large plaque in the carotid, large plaque, and with a very abnormal velocity or blood flow.
But she sent me to have an MRI, and they found something, and so they sent me to a neurologist who ran tests and finally sent me to have a CAT scan, and found out that my carotid artery was blocked. So she sent me to St. Luke's to a Dr. Krager who put a stent in.
People will have dizziness. Sometimes there are no symptoms. So silence is not golden here. Silence is deadly. So that's why it's so important to be checked. In the literature, of course, we know that the older we are, the more oxidative stress, the more plaque formation occurs in the vessels. But I have found young people to have already atherosclerosis or plaque formation. So if we can find it at a younger age, in their 20s and 30s, that they're developing plaque, we can protect them from presenting like Ms. Richardson did, you know, with a severe blockage that could only be fixed by surgery.
She's very personable. She has plenty of time to talk to you and tell you what the symptoms are and what can be done, and she's very caring.
Carotid disease can also present with symptoms of numbness or tingling, difficulty speaking, changes in the facial shape. Basically, people may not be able to smile, or maybe they've had small strokes where they can't move their face or speak or move their arms or legs like they used to. So those things should be checked even if they're subtle. You should check with their doctor.
When you find a doctor that you can recommend to your friends and to your family, it's great. I'm not a big fan of doctors, but I just love her to death.
Switching out that bag of chips with your sandwich to 3 ounces of unsalted pistachios will help raise your HDL cholesterol, which is the good kind. BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Jose has a question for Dr. Cliff Thomas. What are the side effects of acid reflux medication?
So the side effects from taking reflux medication that concerns people the most these days is osteoporosis. So there was a study that came out that suggested that people have increased risk. Now I'm not 100% convinced that's true, but nevertheless people are very concerned about that. And now there's a box warning saying that this is only FDA approved for 8 weeks of treatment, and very few people take it for 8 weeks. So it's really kind of the cat's been let out of the box that maybe taking this stuff long term is not a good idea. And the truth of it is the medications don't fix the problem. They can fix the problem of the juices eating away at your esophagus. They're pretty good at that, but they don't fix reflux, and they don't fix your risk of cancer of the esophagus.
Clarivein is a new procedure. It's been out maybe for a year or so. It is a procedure that is associated with less pain, both during the procedure and post-procedure. Patients that have venous insufficiency that don't have it corrected are going to get worse. The question is, how fast will it get worse and how bad will it ultimately get? And that's dependent on the individual, how much of their problem is hereditary or genetic and how much is occupational. The typical presenting signs and symptoms, which include pain, swelling, restless legs, enlarged refluxing vessels. If you have the venous insufficiency corrected, the disease progress will completely stop, and if it recurs, it can be easily treated without significant intervention. When you use laser or radiofrequency ablation to close veins, it's an energy source that produces heat. And So you're essentially burning the veins using radiofrequency or laser. And in order to control that pain, you have to put a tumescent solution, which is a numbing medicine mixed with normal saline, around the vein all the way up the leg. And so that requires several needle sticks, which is uncomfortable, and then that makes the leg kind of full, maybe a little tight, and there's some leakage of the fluid. And with the Clarivein, that tumescence not needed, because Clarivein basically has a mechanical agitator, like a skip rope, that spins inside the vein and traumatizes the lining of the vein, and then we inject a sclerosant solution that augments the effect of the skip rope. When you use an energy source, there's always a risk that you could damage a structure that's adjacent to or near to the vein, such as a nerve or maybe even muscle, that sort of thing. And so with Clarivein, since there's no laser, there's no radio frequency, you're not using a heat source, and so it's, I think, significantly safer. All of the procedures are very safe statistically. The number of complications is very minimal, but I think there is some benefit with the Clarivein with respect to complications.
Dehydration affects digestion, energy level, and fitness. An easy way to make sure you are drinking enough water is to make sure your urine is the color of pale lemonade.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue, so they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body, and she thought, you know, I went through this trauma with the breast cancer, now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get a pouch and scar tissue buildup. So, you know, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, I wanted to get back to me. I got my sexy back.
What a great show that we've had today. And that's going to wrap up this edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really making a difference in people's lives. For more information and to check out hundreds of videos, just head to our website, bestdocsnetwork.com. And if you have a question, comment, or a life-changing story of your own, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com. Thank you for watching, and I'll see you next week.